It's been really an honor of a lifetime to be part of this team at UofL Health. I was telling the governor when he walked in, I said, you know, the last time you were here is when we first had our vaccine. It's been a journey. And I hope we don't have to go through any section of that again, but it's been a journey. I just want to start at the top. There's a lot of caregivers in this room, and I want to stop and I want to recognize their dedication over the past 3 years. It's been incredible. Well, we've talked about this day for at least a decade, maybe more, and University Hospital has been busting at the seams for all that time. There's been a talk about expanding, but it never happened until today. And I'm proud UofL Health is making it happen. Before we get to the details of the future of what it looks like, I'd like to recognize our speakers and some of our special guests, Governor Andy Beshear, Congressman John Yarmuth, thank you for being here, Mayor Greg Fisher, thank you. I don't know if there's a representative of Rand Paul's office. He was on the list. Thank you very much for being here. Pat Malloy, our chair of the board, we're ever indebted to your leadership. Tom Miller, our CEO. Lori Gonzalez, the interim president of the university. Our director of critical care services, who's been here almost as long as I have, but you haven't beat me yet, Kim Wilson. And of course, the caregivers and those who are part of this team. Thank you for being here. Finally, I'd like to recognize somebody who's been kind of shepherding this expansion for just about all that time, Steve Amsler, who's our Vice President of Facility. Steve, thank you. He's had the plans. He's kept them. He's kept them in his drawer. He's pulled them out about once every year and said, can we do this yet? And finally, we're giving him the chance to do it. Oh, that's something, isn't it? A long time in the making. So let's start with Tom Miller, the CEO of UofL Health.
Thanks, Ken. And I also want to thank Governor Beshear, Congressman Yarmuth, and Mayor Greg. I appreciate what you've done for us. You have been our partner, and I can't say enough about Team Kentucky and what has meant to the care of our patients. I've been in many states. I've never had a governor as engaged in health care and the health of this community as I've seen you, so thank you. And I hope you look at this and see, as you go out this building and look across the way, imagine this in about 3 years and what this will do. It is a dramatic change. It's impressive both on the outside and even more on the inside, but the strength of UofL Health will never be the bricks and mortar, but the physicians, nurses, and other professionals taking care of our patients every day. The dedication, expertise, and heartfelt care you bring to our patients every day is inspiring, and this project is for you to have the facilities to continue this rich tradition. I would also like to recognize several members of our various boards that are here and just ask them to raise their hands. We have a lot of boards and a lot of community involvement as we try to set a course in regard to the care of this community. Our UofL Health board members, University Medical Center board members, University of Louisville Physician Group, UofL Health Louisville, which is Jewish Hospital, and the Regional Cancer Center. And I also want to double down and thank Steve Amsler for his work. Truly, when Ken said he's had these plans in his office for maybe 15 years, and we never had the resources to do that, we now have that. So I want to thank all of you for being here. Finally, I'd like to recognize our patients and their families. Your ongoing support and confidence in our team has given us the confidence to invest and to build the future of healthcare in this community. We are expanding for you. Today, I want to give you some details about it. UofL Health is announcing a $144 million expansion of University Hospital. It's a 7-story tower that will allow us to add more beds and provide more rooms to patients. The existing facility was built in the 1980s, which doesn't sound that long ago, except it's over 40 years now, and needs a modernization. All of our patients and families expect private rooms, which we're committed to giving them. The new tower is approximately 200,000 square feet We will add 4 new ORs and for a total of 20. We'll add 24 observation unit to reduce the congestion in the ED, and we're also enhancing our visitor experience. This tower is needed because of the increased need for specialty care and appreciation of academic medicine, which provides revolutionary care. Every day this past year, 40 patients a day didn't get a room in our hospitals, who had to stay overnight in the emergency departments or in our recovery areas because we did not have the ability to take care of that. We're going to solve this with this project. We are a unique resource for our community and the entire region. We took care of 1.5 million patients last year in every county of the state. We are the safety net hospital of this region, and we accept that responsibility. Across UofL Health, we have over 830 providers as our partners in care, and more than 12,000 team members dedicated to providing the most advanced care possible, the best experience, and getting you back to a life that you want to live. The expansion, modernization is a renewed commitment to downtown. And while we expand downtown, we're also committed to bringing academic medicine to the suburbs of Louisville by opening 5 urgent care centers, expanding the Brown Cancer Center, both northeast and southwest, opening the ICUs in Shelbyville, expansion of Fraser Rehab on Brownsboro Road, and the expansion and adding of beds in Bullitt County to our south. Today, we are investing in this community. We are committed to delivering care throughout the community for every person who's in need. We are going to solve an access problem in this community in healthcare, and we're committed to do that. We are Fraser Rehab, Jewish Hospital, Mary and Elizabeth Hospital, Peace Hospital, Shelbyville Hospital, and University Hospital. And with the University of Louisville as our partner, we're going to provide a legacy together to improve the health of our community. This could not have happened without the support of the University of Louisville.
It's been a good day. It's been a good week at the University of Louisville and at UofL Health. So thank you all for being here today. This expansion is going to give greater access to the best health care available for our citizens, our community, and beyond. And it's the next chapter in a really remarkable success story of UofL Health. The story started with the acquisition of Jewish Hospital and the other regional Kentucky One assets, and then UofL Health became a reality under the leadership of Tom Miller and with the help of our governor, Beshear, as well as Senator Stivers and McGarvey and Representatives Osborne and Jenkins, along with other members of our state legislature. UofL Health has been able to save thousands of jobs, stabilize those essential facilities, and navigate the worst of the pandemic by providing life-saving treatment and care. So during this challenging time, UofL Health added more jobs, more access to care throughout Louisville and surrounding counties, and today, this game-changing $144 million expansion plan will again transform health in our downtown core. The investment will give an important facelift and much-needed expansion. But really, it's more important that it reflects our commitment to investing in academic medicine, to drive research and innovation, and to grow compassion and quality care in the heart of our city. UofL and UofL Health play a critical role in the training of physicians, nurses, and other allied health professionals. The project will enhance their educational experiences. The University of Louisville Health Science Center attracts students and residents from across the country and around the world, and this project will help us expand our reach and our influence. I want to thank Governor Beshear for being here today and for his support and guidance during the formation of UofL Health, and frankly for his ongoing support of UofL in general. I want to thank Congressman Yarmouth for his ongoing leadership and partnership, particularly during the darkest days of the pandemic, and most importantly, his commitment to growing Louisville and Kentucky. And I want to thank Mayor Fisher for his backing and encouragement throughout this process, and frankly, during his tenure to help create Louisville as a compassionate city. I want to congratulate Tom, Kim Marshall, and Steve Angsler who led the design of this wonderful project, and everyone who helped us get to this day of celebration. I look forward to the completion of this project and to adding this vibrant source of health care in our downtown. I look forward to the continued progress of UofL Health. It's redefining and reshaping healthcare landscape in Louisville as well as academic medicine. So thank you all, and it's a good day to celebrate.
Well, it is a good day, but before I talk about this great news, I want to say that I know folks in this room and throughout the Louisville medical community are still grieving over the sudden and painful loss of Dr. Sarah Beth Hartledge. She was a great partner to our team and to this city in setting up the largest vaccination site in this state that worked to save so many lives. Her work through Metro Public Health and in her time working with so many of you, she brought leadership, positivity, determination, and while sadly her life ended way too early, so many other people are here today because of her work. Can we give her a round of applause? So Brittany and I are holding her family and her friends in our prayers, and I think the way that we can honor her memory is by continuing the work of bringing health care and healing to this community. And that's what the expansion of this hospital is going to do. This is really great news for UofL Health, for Louisville, but also for the entire Commonwealth of Kentucky. We have seen that access to health care isn't just a matter of right versus wrong, it's a matter of life versus death. And the ability to get 40 extra plus patients in a room with the best care can make such a difference. And this is the right place to make the announcement. This room means a lot to me. You know, there are 2 days more than any others that stick out to me in this pandemic. The first was March 6th, 2020, our first case. I remember exactly where I was when I got that call. But the other is December 14th, 2020. It started down at the docking bay, waiting for the UPS truck, cheering as it pulled up a little early, and then realizing that was a different UPS truck making a delivery. And then the right one came. Opened up the back to what's got to be the most beautiful nondescript box I'd ever seen, bringing it up the elevator, and ultimately coming into this room where Dr. Smith rolled up his sleeve and received the very first shot of hope, the very first vaccine in this Commonwealth. And think about what that day started. You know, we think a whole lot about what more we need to do, and yes, we need to do more. But that vaccine network was the largest logistics challenge since World War II when we had to take it on right here as a state and as a city. And in roughly a year, we vaccinated more people in that small period of time than at any time in human history. And so yes, while we have more work to do, we ought to be really proud of how far we've come. And I've got to thank UofL Health for everything that they have done. This group has been an amazing partner. They've never said no in anything we as a state have asked, and we've asked what in other times would be crazy things. But everybody in this healthcare community, especially in this city, put the lives of our people and navigating this pandemic ahead of their own bottom line, and that is really special. That is a group of CEOs coming together and collaborating like never before, because the more people we reached, right, the more people we were able to help. And sitting here today, 2 years plus into this pandemic, I couldn't be more proud of how we have worked as a state, as counties, as cities, and as communities, with everybody doing their very best. Something to be proud of, and for the people at UofL Health, I think God had a little hand in it. You know, we think back in absorbing Jewish hospital, and at the time, what that looked like. You know, at the time, it could have been a pretty risky decision, but thank goodness. Without it, we would not have had the healthcare capacity that we needed, even when we were being overwhelmed. Just think about what that difference would be. And it's worked out so well that UofL Health is the first entity that since I've become governor, that has said we want to pay off our loan early. That doesn't happen for state government. So this expansion is great news for the Commonwealth because you treat patients from all 120 counties. And now you'll be able to serve even more people as hopefully we can put this pandemic behind us and then address so many of the challenges in health that afflict our people. You know, we have a lot of talk about workforce in Frankfurt right now, but what nobody talks about when we talk about workforce is health, with disability and health conditions being one of the top 2 reasons that more people aren't working right now, more than any bill that I've heard or that's been passed in Frankfurt. What we are doing right here will make a bigger difference, not only to getting people back into the workforce, but getting them healthy, making sure that they can spend that quality time with their families and making them productive in any job. Let me be clear, healthcare is a basic human right. We thought that before this pandemic, we know it, and we feel it in our souls now, and UofL Health is helping to make that a reality. In addition to creating space for more patients, healthcare is economic development too. It employs so many of our people in good paying jobs, and we're going to work hard with you to make sure we're training the people that you need. So this healthcare announcement is also an economic development announcement. A $144 million investment in the heart of Louisville, which is on a roll this year with these announcements. And it's also bringing 325 new jobs with it.
Thank you to UofL Health for allowing me to put this great event on my farewell tour. Greg's doing his as well. But this is truly a very special day. And one of the things after 15 plus years in this role and appearing at events like this pretty often is that you realize that one of the expressions we have in Congress is everything's been said, but not everybody has said it. And because we have a lot of people who like to repeat themselves and talk a lot, regardless of whether they add anything to the discussion. And I'm not sure I can add much to the discussion, but I just want to thank everyone at UofL Health and at the university for the commitment that you have made to providing and expanding access to healthcare in this community. It wasn't too long ago, we were down in West Louisville dedicating one of the Urgent Care Plus locations, and I think there are 5 new ones in the past year. And that represents a commitment to our human family that is really, really commendable. One of the things that we know, those of us who work in government, is that healthcare is one of those things that crosses every jurisdictional line and is something that we all have to focus on intently. We know it's a huge part of Louisville's economy and Kentucky's economy and the national economy. It's virtually 20% of the national economy. But more importantly than that, the things that the governor mentioned in terms of making sure that our people have the opportunity to have a healthy life, to make the most of their lives, is so dependent upon what goes on in these buildings and with these great professionals that we see represented here. So I just want to say congratulations and thanks. There's no federal money directly in this project, so I can't take credit for any of that. But the American Rescue Plan, I just want to say, if you think about the American Rescue Plan, and by the way, it was the second most expensive bill in the history of the country, and my name's on it as author. I didn't write one word of it, but because of the procedure that was used, it has to come through the Budget Committee, which I chair, therefore I get to have my name on it. And I'm hoping that the Build Back Better agenda, which has been stalled, at least part of it can be passed, because if I get to about $400 billion more, I will have had more money spent under my name than anybody in the history of the country. Some people Rob Gibbons would probably not think that's a great thing, but you take credit for what you can. Anyway, once again, this is a great day, and this is going to mean so much to Louisville and its citizens and all the great people at UofL Health, the physicians, the nurses, the patients, the students, all those people who will help maintain the high quality of healthcare that we have in this community and improve on it, I am sure. So congratulations and thanks to everyone.
Well, thanks everybody, and the Congressman and I have a little game because we've done this a lot. So it's like, okay, can you say something that nobody else has said before? So we'll try to do that. First, what hasn't been said is this is a stunning piece of architecture here, which, you know, you can throw up a building and it's nice, but when you throw up something when you carefully design and execute a plan like this that we wanted to do for 10 years, Steve, and that makes a statement, that's a wow. And it makes people feel good, you know, when they're going there, because it connotes quality on the outside, quality on the inside. It also lifts up our city in a dramatic way. So I appreciate the architecture and the planning that have gone behind this building there. We really appreciate this. The governor talked a little bit about people in the economy. We have an estimated 75,000 people working in healthcare in this city. It's a huge economic driver for us here in Louisville, including more than 21,000 professionals working to create the digital health and aging innovations of tomorrow. So we believe Louisville is the leader in the world in wellness and aging care innovation. And so that's been a specific focus of our economic development efforts because we got the demographics at our back. Okay, and that's one thing when you're a business person, when the market is growing and you can place yourself there with innovation, it's an incredible combination for us. So we're very fortunate and thankful to have all of those resources in our community. The city was honored to be part of this project. I guess it's fair to say, Tom, with the financial backstop through some general obligation bonds for the project. So we got to pay for these things, and we try to get them done in the most cost-efficient way possible. So we're happy to be a partner on this particular effort. So I, too, would just want to thank all of the U of L partners that have gotten together to make this happen. I think U of L is on a nice roll right now. And one thing, when I think about U of L, I think about grit, I think about tenacity, I think about moving forward as an urban university. We have unique challenges, but the team at U of L delivers time and time again. So good job to our team, from Ken, Tom, Madam President Gonzalez, Steve, and the team. Really appreciate all the good work that you all have done. As I close, I just want to say a few words about COVID and what COVID taught us as a state and as a city. Leadership is so important when you have a crisis, and how do you get through that? And the pathway is often unclear. With COVID, we were fortunate we had an enemy, so to speak. I mean, we had a clear objective that people came through to get it done. It really helps to have a governor that believes in science. I appreciate that. A lot of my colleagues around the country had a lot of battling going back between cities and governors that did not want to have common sense science protocols in place. So it starts there, and then it comes together at the local level when our healthcare community comes together. Our vaccination task force in Louisville, the combination of our hospitals, all of our hospital systems, our scientists, our nonprofits, our business folks. I chartered them, and they were calling the shots as we rolled out our plan focused on equity here in our city. And amazingly, unlike most every place in the country, because of our focus on equity, our black and brown populations in Louisville suffered no disproportionate consequence from this virus in terms of infections or deaths. And that is one heck of a statement to the team our city put together to make that happen, and very, very unusual. I want to commend Kim Wilson here, because we've spent a lot of weekends together encouraging people to get their shots. And so we got to know each other in the U of L Health team throughout the pandemic, and I think a lot of people got to know new folks throughout that time. That makes us even stronger to kind of create that social muscle that we need for the inevitable next challenge that's going to come our way. So Kim, to you and your team, thank you. To all of the healthcare professionals, we still need to take a nap, I get that, but it's been a long 2 years, but it's amazing what humans can do when there's a challenge in front of you and you just keep getting through it one day at a time. So thank you all very, very much. And I too want to acknowledge a really special team member that our healthcare community just lost. The Gov mentioned that, but it was stunning and heartbreaking to us when we got the news about Dr. Sarah Beth Hartledge. And the most unusual of things was, if you're a reader of the Courier Journal, there was this interesting article about this doctor that was flying to Orlando, Florida for a healthcare convention, and there was a medical emergency on the plane. And so they said, is there a doctor in the house? Or I guess they say, is there a doctor in the plane? And so, not surprisingly, she pops up, goes to the back of the plane, and delivers emergency care to this particular person, probably saving their lives. No big deal, just another life in the day of Dr. Sarah Beth Hartledge. And then it was that next morning when we received the news of her certainly untimely and tragic passing. But she did one heck of a job for us as a city. She was only with our public health department 2 or 3 weeks, and then the pandemic happened. And then she was appointed to be our lead in that effort in terms of education for the community, testing, administration of vaccines. And so as the vaccines came along, we stood up LouVax very quickly, and she was in charge of that effort. And Sarah was, relatively young at that time, probably 35 years old. So we gave her an enormous healthcare challenge, but then also it was a significant business challenge. How do you start from scratch a mass vaccination facility, which was one of the first in the country and heralded on the front page of the New York Times? So I'll forever remember her, not just as a caring healthcare professional, but as a great entrepreneur, because they were turning the improvement wheel there hourly to where, as you all know, many of y'all participated in that, where we were moving thousands of people through there a day. And it was so full of joy because people, one, were just so relieved to be able to get the vaccine. And the amount of people that I would go and talk to at their car getting their vaccine that were literally in tears because they were concerned about their life or their grandchild's life, but to be able to come through that and get that shot of hope was amazing. And Sarah Beth and that entire team that put that together, that will be a major legacy for everybody that was involved throughout that for our community. So again, maybe we should just kind of stop for a few seconds here, a moment of silence, and send our prayers to Sarah Beth and her team.
I'm Pat Malloy, and I'm here just because I'm a volunteer citizen who serves on the board of directors of the University of Louisville system. I'm a bit of a, where's Dr. Gonzalez? Yeah, I'm a bit of an accidental board chair because Neely had the audacity to go to Penn State, and she was the board chair. I want to say a few thank yous and then just a quick remark or two. Dr. Gonzalez, I want to thank you. I want to thank all the leadership at the University of Louisville for being a great partner to this new institution. As Tom said, this is the bringing together, Lou Ann, of 6 different hospitals. As you know, you were one of the godmothers at the Jewish hospital system in this town for a lot of years, and bringing together these 6 disparate hospitals and building around them an academic center, Tony, that you helped lead as the dean of the medical school, is an extraordinary accomplishment that's been done in the last 2 years. It was all done sort of pre-COVID. I got asked as a citizen to come aboard, and for those of you that don't know, there are 11 folks that serve as volunteers on the board of directors of the University of Louisville Health System that work with Tom and Mike Duzick and all the team members that have helped lead this team over the last several years. There are 6 of us that are kind of truly independent outsiders. I'm a lawyer guy who stumbled into healthcare and spent most of my adult career in healthcare over the last 25 or 30 years, but there are other healthcare leaders and citizen volunteers, and then there are insiders at the University of Louisville like Tony Gansel and other doctor colleagues and Dr. Gonzalez, and those 11 folks, and Tom educated me the other day, there are 11 working advisory boards in this town that are real working boards for all of the physician groups in the hospital system, so it's an extraordinary network of volunteers that spend a lot of time helping make this place what it is. A lot of thank yous have been made, and I will repeat just a few of them. Andy and John and Greg, who are old friends of mine, and I'll be audacious enough to call you by your first names. I've known you for a long time. Thank you. Thank you all for your leadership, your partnership. You care about this town, as most all of us in this room do, in a really deep, abiding way. The last thing I want to say is this place is personal to me. Behind this beautiful facade, Steve, that you've designed over here in that old concrete building, my son was operated on 9 times because University of Louisville was the only place in this town that had the specialist Dr. Seligson, who many of you know, who was able to take care of a long bone trauma that my son was born with. And on the other side of that pedway, healers at this place healed my wife 11 or 12 years ago. So for me, this is, it's holy ground. And as I was sitting there listening to all these women and men talk, the last thank you I want to say is to all you caregivers that are here. There are nameless nurses and aides and orderlies and dietitians and cooks and housekeepers, all the people whose names we will never know that do the real work inside this place every day and make it an extraordinary place. And you don't get thanked enough. Some days you don't get thanked at all, and frankly, there's not enough of you. We've all read about the Great Resignation and the Great Resettlement, or whatever you want to call this disruption that's occurred in our workforce. But this place does extraordinary work. It provides extraordinary access, and it really is, Tom used the term, and it's a term we use a lot, but we don't really think about it. It is the safety net. It is the place that takes care of the least of us. I've been blessed to have, I could take my children and my wife anywhere. I'm lucky enough to have access to anything I can write a check for. But most Louisvillians don't have that kind of access. And that's why this place is different and it's special. And the work you all do, all of you caregivers, I want to say a thank you today. So this place means a lot to me personally, as you can tell. And I'm so proud, Tom, of what you all are building down here. This is a game changer in this town.
My name is Kim Wilson, and I'm a very proud nurse and to work here at University Hospital. And as my mother used to say, as I get older, you become a crier. So coming after you and you cheering up is not good. But anyway, today is a new beginning in the life of University Hospital and our employees. At some point, all of us have looked over our lives and realized something needed to go, so we can make room for something better, a new beginning. For me, nursing was a second career. So when I decided to pursue what God created me to be, I had to make space for it. Because when we want new things in our lives, we must make room. Because whatever it is, it will need space to appear and to thrive. So whether it's ending a bad habit to be healthier, making more time for your family, giving up an old love for a new love, or digging up the dirt to build a new tower, you must create space for the things you want. And what we are creating here at University Hospital is more than just physical space for our employees, for physical space for patient rooms and operating rooms. What we're really creating is more space for our employees to learn, more space for our employees to serve the community, and most importantly, more space for our employees to make a difference in the lives of our patients and families.
It's great what we're doing today, and it's going to be even greater in about a year or two when it starts coming out of the ground. So thank you very much.